students of one of the dentists.
I'm Gloria Dagenhart, and I'm a physician assistant.
So I'm Jenna Ingersoll. I'm a third-year medical student at UW-Madison.
My name is Kimberly Lansing. I am a family physician at Gunderson Lutheran in La Crosse, Wisconsin.
I'm Ryan Larley. I grew up in Edgerton, Wisconsin, just south of Madison. Went to school at Grinnell College and majored in biochemistry and anthropology.
My name is Brad Peterson. I grew up near Waukesha, Wisconsin, and I did my undergrad at UW La Crosse. And my major was biomedical science.
I'm Elizabeth Body. I'm the family practice physician, and I'm the medical director here at Scenic Bluffs Health Center.
Never really intended to be in a small Wisconsin town. I'm from Chicago originally. I went to college out in Cambridge and Boston area.
Well, my dad's a physician in a small community, and he really enjoyed his career. It's a lucrative career, but it's also a really rewarding career. And I'm really interested in the science, but I'm also interested in working with people. And I felt like it was just a great way to mix the two together.
I practiced dentistry for over 20 years. The first 15 years I was in the Quad Cities. I grew up in Iowa City actually, and practiced in Iowa for those first 15 years, and was attracted up here because it's absolutely gorgeous up here. Very, very beautiful area.
So I'm originally from Platteville, Wisconsin, which is a town of about 10,000 people. Which is still, it's still a good size, but it's small enough,
I was pretty much a science major, so I was looking around for fields I thought I would like that I could use that degree with, and the medical field just seemed to fit me best. It was something I could go into. I knew I'd have to work really hard, but I also knew I could make a big change and have a big impact on people's lives, and that was really important to me.
I've been in the medical field for about 15 years. I think I've always been interested in it since I was young. I just always wanted to be a doctor as long as I can remember. I think I was influenced by some relatives and people in my community that were physicians, and I really respected them and what they did.
My family and I decided to move to a rural area for personal reasons. We wanted to start a farm and be a little more self-sustaining, and that's a wonderful difference between living in an urban area versus a rural area, depending on what you like to do with your personal life. A lot of outdoor activities, a lot of just general nature and beauty, and as soon as you walk out your door, you're stepping into a scenic view.
So one of the reasons why I want to practice rural medicine, I think, is because I just don't want to live in a city. That the way I grew up is the way that I want my future children to grow up. I think the lifestyle was great for me.
So the main reason we moved here really was to raise our kids in this kind of environment. I think it was worthwhile. Both my kids now are in college at University of Wisconsin, and I think that they would tell you that they had a great experience being in a small town.
I think the thing that I like the most is being able to follow through a patient's life with them. As a family physician, they always say we take care of people from the cradle to the grave. Being able, as a primary care physician, to act long-term with these people and really go through their life phases is very rewarding.
First and foremost is the people. I think the patient population here is really incredibly appreciative, and they go out of their way to let us know that.
For me, a big thing is working with people. I always knew I wanted to do something in that area, but the thing with medicine is you have a chance to make such a big impact in someone's life. And someone comes in with a broken arm, you help them fix it. They can return to doing something that they enjoy before they broke their arm. They're very grateful for something like that. If you make someone healthy again, and they can return back to their lifestyle, they're going to appreciate that. So I thought that was really rewarding.
It's just a wonderful community. I actually get phone calls at home from patients. They feel comfortable enough to call me at home. We're listed in the phone book, and yesterday was my day off, and I think 3 people called me.
I think the rural area for dentistry are just the fact that you get to interact more with people that you have more contact with, and so you have more of an intimate relationship. And maybe you get an effect or have an effect on them as far as being able to interact outside of work.
And I think that's huge, you know, that's how I think people can keep each other accountable and sort of keep each other motivated to do those things that help you stay healthy. Is sort of being a community. You know, I think that's what it is.
Career-wise, I like the advantages of working in a rural area where we are a central access point. I feel like I get to do more for each patient than I did when I was in an urban setting.
You know, I really like the intimacy of a rural setting. I like the smaller clinics. I think it's really nice because the different providers in the clinics and the different people that work there can really get close and work together on a patient's health care, whereas when you're in a bigger, more spread out place, it's a lot harder to really kind of bring in that sort of personalized care that you can get in a rural setting.
I think the advantages of working in a dental facility based in a rural community are the fact that you get to know the people that you work with. The people that you work with are the people that you see in the street. They're not. When I was in the Quad Cities, I would see people, and very rarely would I have any interaction with my patients. Versus here, most of the people I work with, I see often.
But I think the advantage of rural medicine for me is, you know, I've lived it growing up. I had a great childhood experience in a small town. I felt like I was able to get actively involved in the community. And I also was able to see my dad, who was also a physician, get involved in the community. He was on the school board, he was involved in organizing church activities. And, you know, just everyone around town knew him, knew that he was a great physician and really looked up to him as a leader and as a professional. And so I kind of use my dad as a model for what I would like to be, or how I would like to impact a small community.
I'd like to think that I've contributed by providing high quality orthopedic care that didn't exist here in a small rural area. And to be able to do that in this kind of a rural setting, I find very exciting and very gratifying that we can bring that to this population.
It's wonderful to be in the country, the health benefits. You know, you don't have the smog and pollution and crowds to fight, and you don't have to worry about traffic, and it's just very, very nice, healthy country living.
And because it's such a small community, everything you do, you know, it spreads like wildfire. People hear about how great a physician you are, you know, what sorts of things you're doing differently in the clinic that is helping people. And so people hear what great things you can do more rapidly than maybe in a larger city.
I get to manage a lot more. I get to be more involved with my patients. I still have the specialists available to me if I have questions or concerns about management or care. I call them up, they give me the recommendations. Patients will still go see them, you know, once a year. But then I still get to be their primary doctor, and that's why I went to medical school. That's what I wanted to do. I want to take care of patients to the best of my ability, which I feel like I have a better opportunity to do that here than I did when I was practicing in an urban center.
I think there are different sets of problems that we see in urban versus rural. You know, we see similar types of problems, but, you know, sometimes one of the things that we often overlook in rural medicine is we sometimes see more depression and stress because, you know, when you see a lot of people in agriculture, there's a lot of variables there that you can't account for, and so people have to really roll with what happens to them. And in urban areas, we see a different kind of stress. It's, you know, you see different financial and social stressors. We see more problems with drugs and some of the things like that, and school stressors.
There are definitely personal advantages to living in a rural area. There's plenty to do around here for outdoor activities. Always. There's a little bit of a slower pace of life, which is a nice advantage to living in an urban center. We still have urban centers that are very close by. I find a lot of advantages of living here, just with a better sense of community compared to living in the middle of a city.
Yeah, we're 20 minutes from Wildcat. State Park, and it's a beautiful area. We like taking the kids out there. If you guys haven't been hiking out there, you should try it. Some nice trails, and the Kickapoo River runs through there, so it's nice canoeing down there. There's canoe rentals in Ontario. And just the area in general is a very, very nice area.
And there's no traffic, and there's great country roads for bike riding and the kind of recreation that we like to do, snowshoeing. We made friends here. We put down roots. This is where we're going to be.
Yeah, I'm definitely an outdoorsy type person. I like to bike, I like to hike, and I like open spaces. And I could definitely see myself, living out on a farm, as long as it's within 20, 30 minutes of wherever I'm working.
I think the rural setting really lets us expand on some things we enjoy doing. We enjoy working with horses, so we have the space to do that. And, we have chickens and all kinds of other creatures around here. And I think it's nice for my family, too, because it gives my children a sense of responsibility. They learn to do chores and take care of people, animals, whatever other than themselves.
Mm-hmm. My husband and I live on a farm, and I raise horses and sheep, and there's a bike trail that I can see out my window right here, so we take our grandkids and our children and we go biking on the weekends, and there's a swimming pool a couple of miles away, and the state park down here is Wildcat Mountain, and they have like 50 miles of horse trails.
I mean, first off, I don't know if you can see on the camera here, but looking out back there, you have all this space, and you're not on top of each other like you are in a city with your neighbors. And I definitely like doing stuff on a lake, going for bike rides, have that outdoor mentality. And when you're in a smaller setting, you have the opportunity to do that just because there's not always a sidewalk where you go, and that's kind of nice once in a while. It's great.
I would say if you're considering an urban versus a rural practice, or urban versus rural setting for where you want to live, try them both out. You have time, at least in medical school, to do rotations in various places. Don't discount one or the other. Find out which one fits you best. Find out which people you feel like you connect with.
If you're interested in medicine, you should definitely shadow some doctors and see what you want to do. But if you have the chance, shadow a doctor in a big city versus a smaller town, and I think you'd be surprised by the differences in what you see. I mean, even now, just being medical students, the stuff that we're exposed to in a smaller community with family practice doctors, we're doing a lot more than I was ever exposed to when I would shadow doctors in a city. So it's the scope of what you can do is completely different, and you just have to find what fits for you. So make sure you research what you want, because it's a big decision. So take your time and make a good one.
My best advice is find a program where you can give each one a try. I think it's really hard to go in and sort of guess what something is like if you haven't been there.
One piece of advice I would offer to anyone thinking about going into rural medicine is thinking about not only the career but also your personal life. Because, I know I have plenty of friends who say, I think it's great, but it sounds kind of idealistic, and I want to have access to like an art gallery or a, urban whatever you have in cities that you don't have in smaller towns. You just really have to think about the lifestyle that you want.
So my advice would be to try to do rotations or get experiences in both different areas and see which one you really like, which one really calls to you.
Another piece of advice that I would offer, just in general, is to really kind of think about what makes you happy, what you can envision yourself doing, something you're excited to do. So looking for those be it a region or a facility or a town, whatever it might be that will make you happy, I think is really important.
Under that light rain, beaming in that night game. Can't stop now, keep moving, no break paths. Came here to prove a point, live my life on the field, make history in between the base path, and compete against the fear that is in me. That's my only barrier, and I swear that I'ma break that. From the mud, the cleats that we drug through the feet, this is that moment and you cannot take it back. And I don't really collect cards anymore, just a box and some old